get you situated here with my double chins. Oh yeah, we can see. That's perfect. Okay. Let's get started. Okay, so I'm gonna knock on the door, and I'm gonna wash my hands. And I say, hi, Miss Short. My name is Shaylee. I'm gonna be your nurse today. How are you?
I'm good, thank you.
Okay, and what are we seeing you here for today?
Just a general checkup.
All right, perfect. So first I'm going to ask you some silly questions. So I need to verify your name and date of birth.
Amber Short, 7/1991.
And for this, we'd look at the chart of the patient wristband. She's here for a general exam, so I would say that we're going to have a chart that we'll look at to verify. Can you go ahead and tell me about how tall you are?
5'4".
And about how much do you weigh?
160.
Perfect. So the patient, we can already tell, looks well for her age, of course her race. She's a white female, alert and oriented ×3 based off our assessment. Looks well dressed for the environment, dressed appropriately, and she's in no signs and symptoms of distress. We went ahead and got her vital signs prior to our video here, and I've got them written down. They are 137/74 for her blood pressure. She has a heart rate of 86, a respiratory rate of 18, and she's 100% on room air with a temperature of 98.1. All right, so for my exam today, Miss Short, I've got to do a lot of annoying little things to you, okay? So you just bear with me. The first part of the exam, we're going to do a head-to-toe assessment. So I'm literally going to start with your head, and we're going to work our whole way down to the toes, okay?
Okay.
So for her head, we can already tell that her facial features are symmetrical. She's got her hair down. It looks well groomed. Let's see, appropriate for her age. I think I've already said that. I'm going to go ahead and take a look at your head, okay? So we're going to feel... She's definitely normocephalic. I'm going to take a look at your hair, okay? So we can already tell there's no bumps, lumps, lesions, infestations, everything like that looks good. So from the head, we're going to go to the neck. So I'm going to take a look at her neck. So we can already tell that the trachea is midline. If you don't care, I'm going to go ahead and check your carotid pulses, okay? So we just want to make sure she has carotid pulses. You are indeed alive and well, my dear. Any issues there? Thyroid's soft, non-tender, it's palpable. Did I already say facial symmetrical? All the good things. Noted no scars, anything of that nature. Now she does have her ears pierced. No tattoos that we can see, no scarring. The next thing we're definitely going to look at is your eyes, if you don't care. Don't want to stab you with my pen, wrong pen. All right, so we're going to take a look at your eyes. So her pupils are equal and round. Her conjunctiva is pink and moist, of course, and the sclera is white. So all of that's perfect. No drainage noted from what I can tell. The eyebrows have hair evenly distributed. Her eyes open and close well. If you don't care, I'm going to go ahead and take a look at your ears as well. We can tell her ears are well formed. They're not lowered. They're symmetrical to her face. We're going to go ahead and check those as well, my dear. No drainage noted. Check this other one before I lie and you have drainage on this side. No drainage. Looks all clean and good in there. There's no lesions, no lumps, no bumps. They're not low set. She just has one set of earrings. Next thing we're going to look at is that nose, okay? So we can already tell it's symmetrical and midline to her face. She's breathing well sitting there. Her nares are patent. So if you don't care, I'm going to annoy you again. Have you tilt back. I'm going to take a look, okay? Perfect. So everything, there's no septum deviation. There's no drainage. No lesions of anything of that sort. The mucosa is pink and moist, intact. And then I'm going to go ahead. I've got to press on your face, sweetie. I'm sorry. So we're going to just do the sinuses real quick. So you're just going to feel me put pressure around. If it hurts, say anything, just go ahead and let me know. Everything feeling okay?
Yep. Normal.
Perfect. Normal maxillary sinuses, my dear. Next thing, very annoying, I'm gonna do the mouth and the throat, so I can already tell that her lips are symmetrical and pink. If you don't care, that's alright. Your gums are pink and moist. I'm gonna take a look at your little uvula back there as well. Oh yeah, rises and falls perfectly. Looks great. Of course, the tongue and the floor of the mouth are midline. I didn't see any deviations of anything. No lesions, no sores noted, anything like that. No redness or discoloration, no exculates. And the uvula is symmetrical and it rises and falls perfectly. So thank you for that. Next thing I gotta do, it's gonna annoy you. Might have to have you take your hoodie off. We gotta do the whole respiratory shindig.
Okay.
Of course, her respirations were 18. When we counted those earlier off a video, they were equal. No labored breathing of any sort, but we're gonna show you. All right, perfect. Oh, we're matching today, twinnies. All right, so for respiratory here, I'm gonna make you do a bunch of crazy things. So we can already tell the way she's breathing. She doesn't have any retractions or anything. Thorax is symmetrical to her chest. The expansion's normal. She doesn't have a barrel-shaped chest or anything of that nature, so that's all a plus. I'm going to go ahead and listen to the apex of your lungs first, then we're going to move to the bases, okay? So when I tell you, we'll just do a deep breath in and out, okay? Make sure we got our bell on here. Perfect. So we listen all the way from the apex to the bases. Lung sounds are clear all the way throughout. So next thing we'll do, if you don't care, I'm going to listen to your chest. Now noted, I was supposed to listen under her shirt, but we are kind of in a work environment, so I'm not going to like make her strip right now. So we're going to do the cardiovascular system, okay? First thing I want to do is that apical pulse. I might have to lay you back a little bit if that's okay, just because I have to count that for that full minute, okay? So I'm going to lay you back a little bit there. You good like that?
Yeah.
Maybe put your legs up? Okay. You care if I slide under your shirt? Okay. Alright, sissy. Sorry, I know that's cold.
Okay.
So we're gonna look at this clock up here on this wall. We've got to count this for a full minute, and then we'll begin. So apical heart rate's actually 86 as well. Shocker. I thought it would be a little different. And then I actually forgot to listen to the front of your lungs, so I'm gonna back up and do that.
For me, rise up or
Yes,
stay?
please. Okay. If you don't care.
Mm-hmm.
Okay, we're gonna do the same thing.
Forgot what I was doing.
Okay, I forgot there for a minute. Well, while we're here,
Might as well.
we're gonna do cardiovascular too, because we can go ahead and hear S1 and S2. I don't hear any murmurs of any sort, so that's a plus. Perfect. I'm gonna go ahead and, while you're sitting up, I'm gonna palpate you here just a little bit. Sorry, poke, poke. PMI is non-displaced. There is no thrills palpitated, anything like that, so that's perfect. I'm gonna do the gastrointestinal system if you want to lay back. Would you like me to put your feet up, or?
Yeah.
Yeah. Might as well be comfortable. Okay, so for GI, we're gonna make sure that we look at her figure, of course. Her figure. Oh, figure, of course. Her contour's perfect. She's equal and proportionate for her height and weight, especially for us in medical care. So I'm gonna raise up your shirt. We're gonna look at her stomach, so everything is proportional. I don't see any types of hernias or anything from here. We're gonna examine you, of course. If you don't care, I'm gonna go ahead and start with the bowel sounds, if that's okay. Are you hungry, Sissy?
Might be.
So we've got bowel sounds in all 4 quadrants. Sounds normoactive to me. Next thing I gotta do is palpation, of course. So I'm gonna press on you a little bit. You tell me if it hurts. This quadrant, okay? Move over here. And move over here. And over here. All right, perfect. So palpation, her stomach's soft, non-tender. There's no guarding, anything like that. I'm gonna be quite honest with you. We're gonna have to do the percussion next.
Okay.
Okay. So I'm gonna do the same thing, and we're just gonna do a couple of little tabs, see if we hear anything else different. Sorry,
You're fine.
I don't wanna hurt you. Okay, perfect. So let me get that. Okay, did I say no scars? No scars. We have no scars here. We're good. All right, the next thing is we're gonna do musculoskeletal system. When you were sitting up straight, I didn't see any misalignments of the spine or anything. Muscle mass looked great to me. Normal muscle tone. Yes, probably. We're gonna do the cranial nerves next. So, of course, we already did cranial nerve 1, which is olfactory. So you haven't had any problems with your smell, anything like that.
No.
Nerves look patent. Just for this purpose, I'm gonna have you cover up one nostril, in and out, other side, in and out. Any trouble with that?
No.
Okay, perfect. So this next cranial nerve is cranial nerve number 2, and it is the optic nerves, and we're gonna test your visual acuity, okay? What did I do with my card? Okay, well, let me find my card. Hold on. Okay, here's my card. And if you'll read that lowest line on that vision chart there for me.
PEZOLCFTD.
Perfect. Cranial nerve number 3 is the ocular motor, which that's just a fancy word for Perla. We all know this. So her pupils already, when we did her head assessment, were equal and round. So now we're going to see if they're reactive and if they accommodate the light. So what I'm going to have you do is just hold your head real still for me. I'm going to shine this light in both eyes. So we're just going to look right at me. Perfect, beautiful. Perfect, beautiful. All right, so the next cranial nerve is cranial nerve number 4, which is trochlear nerve. This all kind of goes together with cranial nerve 5 and 6. 5 is trigeminal. So I'm going to go ahead and give you a soft touch and a sharp touch. You tell me both, okay?
Okay.
So I'm going to start with the first one, and you just tell me. So, okay. And then I have to poke you, sister. Sorry. I'm going to poke you. All right, perfect. And then the 6th cranial nerve is the abducens. This is the cardinal field of gaze test. So what I'm going to have you do is I'm going to have you stare directly at me. We're going to do the same thing with the pin light, okay? So I'm going to be right in front of you. You just look right here. We're going to do the same thing.
Okay.
Okay, we're just going to follow. Well, did I turn it off? I didn't want to blind you. So we're going to go here.
I'm looking at the pin.
Yep. And then back. And just an extra step. I like to do like we do with the neuro with the nose touch. So I'm gonna do the same thing with my fingers this time, okay?
Okay.
So we're just gonna keep our head straight. We're gonna touch our nose. When I move the finger, we're gonna touch the finger. Got
Okay.
it? Okay. So, no. No. Okay. No. Two. Nose. Two. Nose. Three. Nose. Three. Thank you. Perfect. The 7th cranial nerve is our facial nerves. So this one's weird. So this one I'm gonna have you don't have Botox, do you? Okay, perfect. So weird question, but I gotta have you grimace at me. So what I'm gonna have you do is you're gonna smile real big at me, and now you're gonna frown at me. Perfect. Open and close your eyes. Now you're gonna puff your cheeks out like a blowfish. Perfect. And then what I forget? Raise your eyebrows. Yeah, you're excited. Okay, perfect. 8th cranial nerve is the acoustic. So I'm doing a weird little sound. You tell me if you hear it both ears. We're gonna start with this one.
Okay. Yes.
Perfect. And this one.
Yes.
Perfect. Cranial nerve number 9 is the I always mess this up. Please don't laugh at me. Glossopharyngeal. So this is just to ask if you have any problems with your gag reflex, taste, anything like that.
No.
Okay, we take the patient's word for that. We're not going to test that. The 10th cranial nerve is the vagus nerve. So this is what we've already assessed, but we'll do it again for the purpose. That's that rise and that fall of that uvula, okay? You don't have any hoarseness, you've not had a sore throat, anything of that nature. Okay, so for this purpose, I gotta do it again. If you just open your mouth. And so, again, perfect rise and fall. Tongue floor with the mouth is symmetrical. Perfect, perfect, thank you. The 10th cranial nerve is the spinal accessory. So, weird test again. I'm gonna have you shrug your shoulders. Perfect. And then I'm gonna actually get behind you here, and I'm gonna kind of put a little hold on you.
Okay.
And when I put that little hold on you, you're gonna try to, and I'm gonna pull you back. Yep. And then this one's called a face push. So what I'm gonna do is I'm gonna get that lock on you, and I'm gonna try to pull you back, and you just try to pull away from me.
Okay.
Got what I mean? So I'm gonna hold you, and I'm gonna pull you back. Perfect. And then I'm gonna pull you this way. Perfect. All right. Last but not least for those cranial nerves is the hypoglossal. This is just the weird one that we have when we do the stroke. So I'm just gonna have you stick your tongue out at me and side to side. Perfect. Appreciate that. Next thing we're gonna do is I'm gonna make sure that basically that you can walk appropriately and you have good stability.
Okay.
So if you want to sit right there first, I'm gonna have you do the shin test. So we're gonna rub.
Yes.
Oh, okay, we're coming. Okay, we can do it. We can do it. CPR in progress.
Okay.
And rub the shins. And rub the shins. Okay. Next one, I'm gonna whack you. Dr. Linda, I have a CPR in progress. I've got to pause this. I'm so sorry.